Welcome to Positive Philter with your host, Philip Wilkerson, a podcast that focuses on friends, family, health, and career, with a little self-help along the way. Please join me in this journey for self-improvement, and I hope what I have to share will make you a better person, thus making the world a better place. I hope you enjoy the show. I hope you enjoy the show. Hello, Positive Philter listeners and listeners all over the world. It's Philip Wilkerson back with another episode of Positive Philter. I'm joined by a special guest because everyone is a special guest for taking their time to join me on the show. I'm joined by the good doctor, Dean Melissa Perry. And I had to make sure I put that in there, put respect on her name, because as I pursue my doctoral journey, I love putting the word doctor on everyone because I know how hard it is to earn that. So people could say, oh, don't just call me this. I'm like, no, if you're a doctor, I'm going to call you doctor whatever, because it's quite intensive and you earn that. But before I get started, Dean Perry, please just give us a little overview of your journey of who you are and how we got to this space here at George Mason.
Absolutely. Thanks so much for having me, Philip. It's a fantastic podcast. I've had a chance to listen to some of the episodes. I really enjoy it.
Thank you so much.
So I actually grew up in rural Vermont, in northern Vermont, and it was the kind of environment that was very economically isolated. And I got a sense pretty early on that if I was going to make my way out of this rural isolation, I was going to have to invest in education. Mm-hmm. And I really loved learning from a very young age, no question. At the same time, my family situation wasn't very good. My dad had left us at a very young age. I was 2 when he left. And then my mom was always trying to make ends meet and try to support us. So in many ways, as a kid, I was kind of left to fend for myself. But I knew on some level that I was going to have to make my way. In high school, it wasn't easy at all, and I was oftentimes in trouble. And without any kind of guidance, without any kind of support. But by the time I made it to college, I made it to the State University, the University of Vermont, and I made it there on a full free Pell ride. Wow. I was so grateful now, all these years later, reflecting on how fortunate I was to have that kind of financial support. Once I got to college, a lot of the misbehavior had already left me. And I was ready to really buckle down and focus on education. And from that point forward, I kept on advancing. As an undergrad, I was interested in psychology because growing up, there were a lot of problems in my community. There was alcoholism. There was definitely drug use. There was marijuana use, cocaine use. There was incest.
I never thought about that as an issue until you thought about Vermont. I saw you're my first Vermontian. And so I'm learning a lot about, pockets of the United States that we're not very familiar with, like what kind of issues are there in rural areas.
Rural areas, yes. Yeah. I'd say that those issues weren't unique to Vermont per se. They're actually not that uncommon in very rural places where you have no economic opportunity.
Yes.
No way to advance yourself, no industry, and certainly no way to go out and experience the world. So all of us were not traveling. We didn't have the means, the economic means to, see the world. So many folks would come to Vermont to ski, but they're all coming from other states that were, far more affluent.
Yes.
So, downhill skiing wasn't an affluent sport. It wasn't something that I ever learned how to do.
Yeah, I see that.
And most of my fellow Vermonters didn't know how to ski either downhill. So in any case, I just knew that in order to change my circumstance, I was going to have to be serious about education. When I started at the University of Vermont with an interest in psychology, I met up with a great professor. I read his article in Psychology Today, and the title of the article was, "The Answer is Prevention." And he explained that the number of people in the U.S. who were experiencing some kind of mental disorder was far greater than the number of people that we were going to be able to train in any time to match the labor force demands for people that were suffering mental and emotional and psychological distress. So he really, really lit a fire for me as an undergraduate in psychology to think about prevention, and that's how I got into public health.
Yeah, and that's interesting because now I'm seeing that that's the intersection, right? Like how cross-disciplinary academia could be, right? Before I shared that, communication, that's what I'm getting a PhD in, but how that intersects so much with public health and maybe even people being exposed to different disciplines. So now it makes sense how you were a psychology major, but you were exposed to this discipline or theme of prevention related to health or mental health through, that psychology, but it led to public health. So Johns Hopkins is no small institute. It's a big renowned one. So when you made that leap, how did you make a determination to apply to Johns Hopkins, and not only apply to Johns Hopkins generally, but for public health as all the institutions?
Yeah, no, it's a great question, and that's an interesting story. So this professor, his name was George Albee, and as I say, in the 1970s, he was coming to this conclusion that we weren't going to be able to provide enough individual therapy to respond and treat all of the tens of thousands of people dealing with mental disorders. And so he, whereas I thought I'd probably go into clinical psychology as a therapist, he would explain it in this way. And it's a quote that I've used many, many times with so many of my students and colleagues, and that is, no mass disorder afflicting humankind has ever been brought under control or eliminated from attempts at treating the individual.
Yeah, okay, I see.
So he explained that we can work one person at a time, one relationship at a time, and those relationships are critically important. At the same time, in essence, we weren't doing anything to prevent the next case of depression or the next case of suicidality. So at the time that I'd already gotten the education bug. I knew I wanted to continue to learn and advance myself and my ability to contribute to the world. When I was applying to universities for graduate school for a master's degree, Johns Hopkins was the population-focused public health place to go. Yeah. And there was a department of mental health, mental hygiene at the time.
Let's call it hygiene.
Mental hygiene.
All right.
At that time. That was in the late 1980s. So it was the Department of Mental Hygiene. And so that department really had that population and prevention of psychopathology focus that I was really passionate about.
Yeah, so it's like what's the approach, right? Macro versus micro, right? Occurrence, we can even take this to education, right? Sometimes, the teachers are in the classroom, one-on-one interventions, but if we do not change the system or the environment in which children learn, then it's kind of like just, you might get one off, but it's going to be a reoccurrence thing, right? And so I think it needs to be concurrent. I put a little picture, right? We still need individual intervention and individual support because everyone is different, but we also need to change the environment in which they live to either prevent the other next generation from experiencing the same things or also just, lessen the overall environment. So macro and micro need to work together. Kind of like what people study in social work, right? My wife was in a program where either you looked at the system of what's going on, and then we had the case managers, right? They wanted to be on the ground, but we need both, policymakers and that. So while you were studying, was it already at Johns Hopkins? I always forget the S. My wife told me to be correct. Did you already see the desire to get the doctor? Was that part of that program? Or, did you apply to both, or it was during your master's program that you said, I want to continue in this path of academia?
Yeah, no, it's an important question, and I really want to share because it sounds as though these were easy transitions. The transition from rural Vermont even to Burlington, Vermont wasn't an easy transition. Yeah. I was so uninitiated, meaning underexposed to the world, whereas so many of my classmates on campus had already seen the world. Mm-hmm. So the joke was they would refer to rural Vermonters as woodchucks. It was a disparaging term. Ooh. It was to contrast almost the city versus the rural, the country folks. So that transition wasn't easy, but I adapted and I did well, and I was able to get a great degree and a great education. The same for going to Johns Hopkins. I drove from rural Vermont to Baltimore, sight unseen, with my Toyota Corolla packed up with my things, and I was going to move into the residence hall in Baltimore.
Yeah.
Had never seen it, had never traveled there. That was incredibly intimidating as well. I was from rural Vermont. I didn't even know what segregation was.
Jeez.
I didn't understand why was it that this neighborhood was all African American and this neighborhood was like a white island.
Yes, yeah, Baltimore's real.
I didn't get it. That was, again, in 1988.
Yeah, that's real.
So once I adapted to living in Baltimore and also making my way at Johns Hopkins and started to perform well, learn a lot, really apply myself, then it was somewhat natural that professors sought me out to apply for the doctoral program.
Got you. People lifting you up and seeing potential. Maybe I want to go back to that, transition. Then was that at every step when people were pulling you up and saying maybe you should do this, were you like saying, no, not me? Or were you just going with it like, oh, if Dr. Abel says I can do it, then I'll just, all right, because I think that's sometimes happens with mentorship, where you put a lot of trust in people you think are, more knowledgeable, and you're like, all right, if they think I can do it, I'll do it, and it kind of helps eliminate a little bit of doubt. How is that when people were presenting these transitions to you? You're just like, I'll go with it because they trust me.
Absolutely. Well, I'd say that their support was absolutely instrumental. I had a guidance counselor that really helped me out of a terrible time as a high school student. She believed in me at times that I didn't believe in myself. Her name was Jackie Roach. George Albee saw my potential. I didn't believe it at all. And I did have those professors at Hopkins that said, well, this student is actually making the grades. She's showing up. She's doing the work. We believe that she's doctoral program material. That doesn't mean that nagging sense of imposter syndrome ever left me, but it was their voices of support and reinforcement that gave me that sense of, okay, I'm going to try. I've got their support. I'm going to try. I'm going to try to do this.
Now, I kind of wanted to, now that we were talking ahead of time, focusing on that leadership aspect, I think that's where I'd like to dive in for this episode. At what point did, as you were going through your academic journey, getting a master's, getting a PhD, obviously I seen on your LinkedIn you're being a professor. Where did it click that was like, okay, maybe I need to take a route in regards to leadership or higher ed, administration? Where did that kind of come into play?
Yes. Well, after Hopkins, I was at a couple of different academic institutions as a faculty member, as a junior faculty. When I became a faculty member at the Harvard School of Public Health in Boston, at that point I started to get really deep in research. And it also meant building a research program, and it also meant acquiring a number of doctoral students that I was going to mentor. So those steps meant that I needed to start to show up further and further as I grew and as I matured. And it wasn't only about advancing my career or my credentials, but it was about investing in others. So it was after 13 years at the Harvard School of Public Health, I was recruited to become chair of the Department of Environmental and Occupational Health at George Washington University School of Public Health. That's the moment at which I understood now life became about investing in the success of others.
Okay. And so that's leadership. I think that's what really happens, right? You have an individual pursuit. And I think most people, if they go about leadership in an appropriate way, they want to serve something bigger. And that's where, before you know it, you're, like you said, pulling other people up. Was that transition intimidating as well? And were there people that you reached out to, similar to all these other transitions, for guidance on that leadership part of like moving into this next phase of your career?
Always. In fact, I think once I became a leader, it was more and more important to be as connected and as human and as transparent as possible, rather than as isolated. So I really was going to start to invest in the needs of the people that were around me. I came to recognize that for any leader, perhaps the most important asset that they have is their human capital. That is the talent that is around them that they are seeking to provide service to. The folks that you're leading, you're serving, you're a servant leader. And so understanding all of the capacity and all of the aspirations and goals and dreams and talents that were in my midst, that's when things became very electrifying, and I felt far less afraid or intimidated or insecure or isolated at that point, once I could start to really invest in the success of those around me.
So, we were discussing earlier that the lifelong learning never stops. You shared that you're still learning. Do you feel like leaders, I think, is that a core principle? Like, if you're a leader, you always have to be learning something new. Because I feel like now you're a dean. For me, you're the pinnacle of a leadership and education. Like, it's a title that's top, right? Dean. But even you say, I still need to learn. So then I was like, okay, no matter how far I rise in a person or a status, I'm always have to learn something, right? I always got to go to class. What are your thoughts on that? Like that you think that all leaders have to always be learners forever?
I think you said it perfectly. I'd say that being in academia is incredible privilege.
Yes.
I've certainly mentored folks. I've had thousands of students. I've mentored them into a variety of different career paths. And I've always said that academia was the most privileged because you had that higher calling of students.
Yeah.
And the paths that they're pursuing, and you're supporting and encouraging and mentoring and guiding that. That is, that for me, it never ceases to be electrifying. It's just very exhilarating to be part of that continuous learning process. So yes, it's really important to model that.
Yeah.
And so it was early on as a department chair, I realized that I'd never been formally trained in any management or leadership theories, models, frameworks. So I started to take classes, which has ultimately led to me being 2/3 of the way there in my Master of Business Administration degree here at George Mason. So I started at GW and I transferred here to Mason. Each of these classes really allow me to be a better leader. So I'm constantly learning, but I'm also very understanding of what our student experiences are.
Yeah, that too. Yeah.
And also, if I'm talking with my faculty about their professorial demands and frustrations, I can relate because I'm in the classroom as well.
Yeah, I think that's interesting. It's funny. I think about lifelong learning. I have now so many models. I'm like, dang, I think I'm always going to be in a classroom of some sort because I like to learn. My dad, he retired from the Army. He took non-degree classes here at Mason. My late father-in-law, when we lived together, I was actually dropping him off with his book bag, just taking classes here at Mason, just random ones too, like jazz or history. I have great uncles that up in Jamestown, New York, that just were always taking class at the local community college. So I feel like that lifelong learning thing, I think that always continues. That pursuit of learning and being better has to be incorporated into leadership. What are your thoughts on that? Is that like a must? I feel like we should make a policy, like if you're a leader, you still have to take at least one class or something.
Absolutely. I think it's absolutely necessary. It wouldn't be interesting and you wouldn't be effective because what we know about leadership is constantly evolving. The expectations and the demands on, let's say, educational leaders right now, changing, during watershed moments of just the last 5 years, for example. So you're going to have to be as nimble as possible. You're going to have to be as thoughtful and constantly getting a sense of your organization, what their culture is, what their needs are, what their expectations are, who are the stakeholders, how engaged do they feel. And also what I've really learned is related to there's intentions, and then there's behaviors, and then there's impact. Yeah. And they are not the same thing by any means. You can have the absolute best of intentions as a leader, but if your behaviors don't align with those intentions, then ultimately you're not going to achieve the impact that you want to achieve.
That's right.
So always keeping that in mind, and then it is a continuous quality improvement kind of process where you really need to be open to feedback as to how you're doing.
Yeah. Now, one thing, I think I remember specifically I met you first time face. Do you remember that?
Yes, I remember. Yeah, we were walking across campus.
Okay, cool. I was like, dang. I was dropping. Yes. I joke with my wife that I can my short term memory where I lost my keys, all that stuff is bad. But I can remember specifically, we were walking. I was with a student, Sean. I said I was so proud. I was like hyping him up. I was like, keep him here. He's going to medical school, and I was so not say taken back. I was so filled with gratitude that you were just so approachable. I said, welcome to Mason. I think I saw you on LinkedIn, and my name is Philip. I introduced myself. And I want to say that because that left a lasting impression on me that even someone at your level of leadership could be approachable. So I wrote an article the other day about masking. How, as you elevate, your schedule is crazy, the demands are crazy, how do you still are able to be a woman of the people, but also understand that you might have to walk differently on campus, right? You might have to, I say put on a mask, but we all put on professional masks. So how do you navigate those identities of you are, a leader, but you're also going to stay true to who you are and just be nice and approachable?
Wow, no, that's a wonderful memory, and I remember us meeting for sure, and I'm so thrilled that it's led to this connection. It's a big question. I mentioned that once I started to become a department chair, I sort of came out of isolation because I started to invest in others. And I learned this critical concept of authenticity, that if I really was going to be able to make a positive difference in the world, if I was going to be able to make a positive impact on people's lives, I had to be as true to who I was as I possibly could and as comfortable in that space. And so the more that I've met, the more people I've met, the more experiences I've had, the more comfortable I've become feeling just connected with others and as human as possible.
Right.
And that includes, to be authentic and to be human, it also includes vulnerability. So I can let go of those expectations of perfectionism. I love this quote that perfectionism is the ultimate form of self-abuse.
Yeah.
So I can let go of those very rigid narratives about how perfect I need it to be, how much of a role model I must be continuously projecting, or how perhaps detached or distant or objective or removed from those around me I should be in order to stand up as a leader. I feel as though it's the absolute opposite, that you have to be accessible, you have to be real, you have to be true to yourself, and you have to be authentic.
Yeah, but this is my gentle, retort though, is though. But then at the same time, a leader is viewed as someone of higher standards, like a team captain, right? Like you can make mistakes, but then you're the first one at practice, right? And I think about that with leadership, right? Or like you make mistakes, you're the first person to be accountable. Or even as a leader, you probably, the margin of your error is greater. I think maybe even it's greater. Maybe it's just greater in perception, like people see it more exposure. So how do you balance that standard of excellence while still being authentic and not fake or perfect? That's where I'm trying to get at, because I think that's something I'm struggling with too, right? Like you want to do well, you want to be exceptional. You also don't want to be fake and say, hi, my name is Philip Woke, and put on this fake voice and act. But at the same time, I understand that I need to have, if I want to be a leader and people are following me, I need to be I need to be prompt, I need to be on time. I need to be, I need to have some level of professionalism and people look at me. So how do you balance being yourself, but also holding yourself to higher standards than others?
Super insightful. I'd say as you were talking, I was thinking about the difference between the internalities and the externalities. What I mean by that is, yes, there is the preoccupation with the optics, with what will others think. I would reframe that and put it back on, well, what would I think? Meaning, what are my expectations for showing up, for doing the work, for doing due diligence, for being fair, for being equitable? What are my expectations? And if I'm being true to those expectations, what I have observed is then others understand that. They see you as a authentic, legitimate person, serious person. And that I think can culminate in what people are looking for in a leader.
Okay.
So I don't feel as though I have to put on a facade or I have to project a certain way of being that's not consistent with who I am internally.
Gotcha. Is this okay? I think I'm still. Yeah, I guess I'm just still processing it, because I think I've been in environments, where I had to, they said I didn't speak with the correct vernacular, professionalism, right? And then I switched it up, and it wasn't true to who I talk and connect with people, public speaking wise. And then when I talked like myself, it was more, it connected with students. And so I learned about different audiences, right, and how do you project and different things. And so I think I think that's always going to be this internalized battle between being true to yourself, but also understanding the optics of identities in certain spaces or perceived a certain way, right? And so I don't know. I always ask leaders how they feel about that, because I think as I've navigated and I've had conversations at bigger tables, I've realized that a lot of leaders feel like that, but they still also have to, tighten up and be accountable, right? I don't know. Like, I will never show up to a board meeting not in a suit. That's the standard, even if that's not my comfortable. I don't like wearing suits like that, right? But I understand the environment requires that. So that's what I meant by that balance. Like, I understand the environment requires a certain type of persona. Is it being fake if I have to really kind of tighten up to be to that persona?
Yeah, no, I think you describe it very, very perceptively. I think back to your example of showing up at the board meeting. So we have the need to flex our styles. So I'm not going to dress in the same way on Saturday morning at the breakfast table with the kids as the way I need to dress at the board meeting.
Yes.
At the same time, when I think about the folks in that boardroom, and if I see myself there, yeah, I'm going to expect that people are going to show up with professional dress. So that's bringing it back to, well, what are my standards?
Yeah.
What are my expectations? But that doesn't mean that we can't be flexible in terms of who we are, and there are different aspects of our lives. It just has to be somewhat congruent or consistent across the board. If my college sees me in my pajamas at home with the kids, this is my way of life, my personal way of life. That's me. And I'm not going to feel embarrassed about that.
Right.
So I think that integration, rather than feeling contorted or pressured to become someone that I'm not.
Gotcha. I love that. And I think that's where I had all these topics about social work and all that when I sent you these questions ahead of time, but I was just so, as I said, it just sparked my mind about your authenticity and your kindness and the things that's something where I'm like, what kind of leader would I like? Like, how would I respond? And I've always thinking about that. Like, I've always responded to a supervisor that looked at my strengths. I've always responded to a supervisor that allowed me to ask questions. So now I'm going to reframe that, because I like how you said that. Like, if I respond well to that, then therefore I need to, on the inverse, do that, project that in my leadership style. Like, make sure that when I'm on campus, I say hi to everybody. Yeah. Make sure that I allow space for mistakes, but guidance. So it's like, I'm going to use that question, like, what would I respond well to, and try to do that, paying it forward.
Excellent. Could I just mention this, Philip?
No, 100%, please.
I've heard this example many times, and that is the ability to dive deep into negative self-talk and to really call it out when it happens. We all have it, and we all have it in various degrees, and we all have it in different aspects of what we're doing. And really a way to neutralize that negative self-talk is to stop and say, well, if I were to reach out to my friend Philip, what would he tell me? Would he be giving me all of this negativity and all of this judgment and all of this criticism? Absolutely not. So as soon as you pitch it back on, well, what are my expectations and internal standards for myself, you start to recognize that, I think people are going to see how authentic and true and real that is.
Okay, so now I will bring it back to your job as the dean. So let's go back to now I think about your public health background. How can you, in your role, envision well-being or the things that we're talking about, authentic leadership? How do we address that at the macro level within colleges? And you can say particularly your college in public health or just the higher ed in general. We're talking about the individual relationships, like my individual relationship with a supervisor or supervisee, right? And you're saying that if we want to make sure we fix a culture and allow authenticity at the individual scale. We're talking about the individual ways, right? So now let's go back to that. I got the little diagram. How can we address those kind of things, the authenticity and leadership at a macro view, similar to your mentor? How do we address that in a system approach instead of just individual relationships of helping people?
Excellent. Oh, I love it. I love it. I love that meta question.
Mm-hmm.
It brings me to the College of Public Health. I couldn't be more excited about it. It's the first and only College of Public Health in the Commonwealth of Virginia.
Okay.
I've been really fortunate to be given this opportunity, this privilege to be the inaugural dean of the first College of Public Health in the Commonwealth. And what it embodies is so consistent with a population health approach. At the same time, we have community nurses, we have a school of nursing who are providing care to people every single day and our students are learning to provide care and to make sure that it's care that everyone can access. So talk about health equity. Talk about ensuring that the most marginalized people, the most overlooked people are seen and getting the best care possible. That's very much a population-based approach with an emphasis and understanding of how individualized support, whether it be nursing care provided by health practitioners, whether it be social work and counseling and social work services and psychological support. And we have epidemiologists that are studying. I wanted to mention this to you. I thought you'd find it really interesting. Back in the early 90s, when I was studying mental disorders in populations, I discovered that what are the methods that we have to determine how many people are in society right now in the United States that have not had any care for their depression, for their substance abuse, for their anxiety. How do you determine that? You can't only look at the people coming into mental health facilities or hospitals.
Because that's the people getting service.
Exactly. So for every one person getting service, there are likely at least 5 others that aren't making it in. So we have epidemiologists that are thinking about the distribution of diseases within an entire population.
Right.
We also have health service experts and health managers that want to make sure that our health systems are, again, accessible, high quality, make sense, easy to navigate, and also are reducing the burden of disease. We say, we're preventing morbidity, diseases, and we're also preventing mortality, deaths.
Yeah, and I was thought about. I love that macro approach because I think, like you said, we're talking about how do we address systems. Therefore, that's a preventive thing, right? Like acknowledging, like, if people getting lung cancer, well, maybe it's not just individuals, maybe it's policy on cigarettes or something. I don't know. Like it's a macro issue. And, but at the same time, I think was it if you're a doctor, you're always going to be in business. Like people always going to get sick. So do you feel? And this is not another probably medical question, meta question. Do you feel like it's always just going to be an unending, a never-ending battle that the School of Public Health will always have to address? Like there's never. You're going to always have to do work. And does that seem exciting, sad, depressing?
I'm glad you raised it. I'm glad you raised it, and I was really hoping we'd get into this. So I wanted to give you a little bit of history in terms of where we are when it comes to the importance of prevention versus treatment.
Yes.
Again, in the early 90s, there was a turning point where the national conversation was about managed care. And it was at that time that an insurance dominating model started to emerge. Public health advocates were hard at work explaining we can't allow health care to be left to the dynamics of the market.
Yeah.
Health care needs to be a human right. It shouldn't be a commodity or a product. That's what we all were advocating for in the early 90s. We understood the pushback against the fear of single-payer and universal health care, or it was referred to disparagingly as socialized medicine. And some of the descriptions were, well, we can't be Canada because we're going to have to wait for our care. Well, I don't know if you have been in the medical system, have had any interactions with the medical system lately, but I would argue that the majority of us are discovering how incredibly complicated navigating that system has become.
Yep.
And so we have de-emphasized the importance on prevention, and we have overemphasized the lucrativeness of disease. Yeah. And I strongly believe that our College of Public Health can make huge inroads in turning the incentives back into population health and preventing disease rather than relying on it to make money.
I'm only smiling because you and my father-in-law would have been really good friends and nerded out on this conversation, because I told you that was his lane in advocacy was about that, right? And so I'm just smiling because I'm like, dang, Jeff, you maybe tapped me on the shoulder to ask that last question. So it is underneath, and we got to, I guess, understanding that advocacy is a fight for generations after you, that this is going to morph, but as long as you are committed, it's going to get better, right? And you've shared generationally how it's gotten better. So that's an optimistic view. So let's end on that.
I feel optimistic.
Yeah, I feel optimistic.
I feel as though George Mason is really ideally positioned to move in this space and to lead in this space and to truly deliver on health equity and to deliver on the critical value of prevention, especially given our configuration with public health, with nursing, and with social work, all combined in a truly intraprofessional approach. This is what defines us. This is what we're most passionate about. We really want to prevent people from getting sick or dying.
I love it. Now, one thing I thought about too, and I have my love for my social work people. One, and I probably could have done some more research, is this, you saying unique as in first and only in Virginia, has social work been absorbed in other public health colleges around the country? Is that unique as well?
Great question. Very few. Very few.
Okay.
So we are a unique model. I'd say there are just a few around the country that also have social work within their school or college of public health.
Yeah.
We see it as an incredible advantage, an incredible competitive edge, and especially because we understand the multiple social and psychological dimensions of health as well, rather than treating it as something different or not a health issue. It's very much integrated. Great example of that. So back to the number of people that aren't getting mental health care. Prior to COVID, the estimates were that perhaps 1 in 5 people would be experiencing some kind of mental disorder, depression, anxiety, substance abuse. After COVID, it became 1 in 3.
Yeah, it's real. That's real. And that doesn't take a scientist to realize how stressful that was on communities, not just individuals, but communities. So, that makes sense.
So does that mean that all of a sudden our genetic predispositions changed in such a limited amount of time? Of course not. It was societal factors, environmental and psychological and cognitive factors that were affecting our overall mental health. So there's powerful testimony to the critical importance of social work and psychology to influence overall health and well-being and prevention of disease.
So I love it. So the integration of social work as a health, you explained it because, and I don't want to say mental hygiene, but mental health and the support of mental health is part of public health. Have you, in your circles around the country, have you heard social workers saying that don't make sense why we're in this program? Or have you more so like, wow, that makes sense. Maybe we envision more social work programs being absorbed and being in the bigger conversation with public health.
I've only had positive feedback for sure. So perhaps the first question, because it was unprecedented, the first question is, well, what happens to the credential of social work? Are we still a standalone discipline? What happens to our accreditation? Once we've been able to truly navigate that there's no threat to the professional identity and the licensing of a social worker and what's required to complete a degree, as soon as we've affirmed that there's no threat to it, then there is only added benefit to be in that macrocosm of public health. And so our Department of Social Work has been very positive and very receptive, embracing what it means to interact with nurses, what it means to interact with epidemiologists, what it means to interact with nutrition scientists.
Right.
Because you have to think about the overall well-being of individuals, everywhere from their mental health to their nutritional health. To their infectious disease status.
Well, I mean, honest, like technically it makes perfect sense because my wife, when she was doing case management for Fairfax County CSB, she was looking at all those things you said, right? Like looking at when she was doing play therapy with children, but she still had to look like, what kind of homes they're going back to, right? Like, what kind of food are they eating? Are they severely overweight, and not getting good sleep? So I think knowing, like, when she does a social emotional plan and types it up, right? She has to type all these different. Did they have any pre-existing conditions? So she wasn't a medical professional, but that's part of the social emotional plan. So she needed to know that holistic view as a social worker or therapist to be able to help that. So I already see that alignment there with medicine and, social work and case management.
Very much so. And back to the time where I really came to understand the prevention approach to mental disorders, along with George Albee, we were writing a variety of papers, and I wrote a paper. It was in the early 90s. I think it was in 94, 95. And the paper was the relationship between social class and mental disorder. Yeah. And I reviewed all of the prior studies back into the 1930s, primarily in the U.S., some in the U.K., to demonstrate, because there was a theory that, actually, people were genetically deficient, and therefore they were predisposed to mental disorders, and so that they drifted downward in social class. That was one competing theory, versus social causation, which is when you're impoverished, you're incredibly stressed, and you don't have access to all the resources that you need to be well. And so I was able to really unpack all of the data, analyzing these two theories, and demonstrate that the preponderance of data supported the social causation model. I'm
going to write that down, because I was thinking like nurture versus nature, but at the same time, now I'm thinking there's no verse. It's both, right? Like, I could be predisposed to certain things by my brain chemistry, right? Be more amped to anxiety or depression. But like you said, living in poverty, that is actual, with economic trauma. If you can't, that's a traumatic experience to grow up through, right? I've heard of that, right? Poverty trauma, right? Like, even when people that grow up in poverty trauma do come across money, they still have this experience of holding on, like overstocked fridge, right? You think about that, right? They have too much food in their fridge and it goes bad because they had this deficiency mindset. So it's both. Yes. So I love that. That's just the way that you wrote it is a scientific, research-backed way to define a not a theoretical model, but more of like a thing I was talking about. So I loved it. I mean, we could go on and on. Like that's why I love the study. That's why I love learning. That's why I love cross-discipline conversations like this with public health people and communicate. Because it's where I kind of nerd out. But I want to respect your time. You're very busy, so I'm gonna surprise you. So this is the part of the show called Shot for Shot. You get to ask me any random question. I get to ask you any random question. You want to go first? I'll go first.
Why don't you go first?
So for the first time ever, I visited the New England area. I went to Cape Cod. I went to Maine, and I put my feet on the ground in Vermont for 2 seconds, checked it off. I say this to say that there's a different vibe. So what, in regards to your experiences, what has been the biggest difference have you noticed since, from the New England or Vermont rural area to the hustle and bustle of D.C.?
Oh, the biggest difference I do tend to think of terms of economics, because as I mentioned, I grew up with nothing, right? Nothing. I remember I filled out the FAFSA in 1983, 84 when I was applying to the University of Vermont, and our annual household income at that time was $6,000. So I remember, just as you were saying, that mentality of scarcity. I remember it very well. So there just was no money and there was no economic opportunity, whereas there's tremendous affluence in D.C., tremendous affluence. And also there is such wealth in this larger DMV area. And there's also a concept of suburbs, for example, and suburban way of life. Yeah. None of that existed. Vermont is a state of about 600,000 people, which is actually smaller than just the small D.C. area.
I mean, we got
D.C.
Fairfax County has 1 million people. So it's like, okay.
Yes. So I think economic opportunity is the biggest difference. Maybe that, and I don't know if you know, but Vermont has outlawed any billboards.
Because
So
where are you
you'll-
going to hang them? There's freeways? I don't know. So, okay, that's my second question. Do you ever catch yourself doing the old, like, y'all spoiled kids, to your own kids? You don't know what I had when I was growing up. I do that all the time now. So do you have to catch yourself? Because I do that all the time. Like,
we do it all
you
the time.
You don't know what. We didn't even have billboards,
We do it all the time. Absolutely. There's a hysterical skit on Saturday Night Live a long time ago, a grumpy old man, and he would say, it was Dana Carvey, and he would say, in my day, we didn't have toys, we played with rocks, and we liked it.
Yeah.
So yes, I do that. I have to confess that I do that. And my husband came from very small beginnings as well, so the two of us kind of pile on.
Okay, there you go. Keep them humble. That's
Exactly.
I had to work on that too.
Exactly. Right. So I want to ask you, Philip, did you ever aspire to be a football player?
No. I mean, so I do look a little heavier now. When I was a kid, I was 150 soaking wet. I liked football. And this is a roundabout way because my father, right? So always going back to my parents, my lineage. My dad was the first class to integrate Hampton High School and played football at Hampton High School. And it's kind of like the Remember the Titans of the Tidewater, where they took a white school and black school, put it together, and they went all the way to states. So if you ever go to Annandale High School and you see like Annandale State Championship 1967 or 68, that's the year my dad went there and they lost, right? They lost to Annandale. And because of that, playing football, my father was also one of the first black students to go to VMI, the first year they integrated. So I grew up looking at my dad's like, wow, he played football, played college football. And so I knew athletics was always something I wanted to do, but I wasn't that good at football. I was good at track. So I always aspired to at least be athletic. And so I did make, college track and I do powerlifting, but it was never football. It was just something of athleticism. Being an athlete was something that I wanted to always just be athletic. And additionally to that, my father lost his father very early in life, due to heart disease, whatever. But when he married my mom, he got kind of like adopted, like a second father was my mom's uncle, like an uncle in the DMV area. That uncle had season tickets to the Redskins or Commanders. So he brought my dad, and that was their way of bonding. And then my dad bought season tickets. So growing up, I always went to Commanders games. So football was important now. So I would say, I had aspirations. I always liked the game of football. I like to be around it. I don't know if I want my son to play it because of concussions, but he loves it now too. But athleticism or pushing yourself physically, which I want to get back to now, was always something that was in our family, for sure, me and my dad.
I asked because before we got on air, you were talking about a friend who went on to college football. Then my son, I'm just contending with it now, as a public health person who studied injuries and how to prevent them. When he started to lobby his dad and me about playing football, we're like, no. And it took him a year. It took him a year of wearing us down. And what he finally said, that was the clincher, he said, but Mom, you always taught us to try new things.
Yeah, well, that's funny. It's very timely. This is the 11-year-old?
This is the 16-year-old.
16-year-old, okay. So it's very timely. This conversation about football is my 7-year-old has been playing football at recess, and he really loves it. And we, like I said, that thing of watching it with my dad. Now we watch football. I took him to his first Commanders game this weekend, and he literally is doing the same thing, lobbying for contact. And I'm like, you can play flag, get your skills up. There's no need. But he's always like, now last night, this is kind of funny. Last night he's like, all right, I'm ready to go work out. And so he wanted to make him do workouts. And like he's I don't want to discourage that. He's really like interested in taking initiative. But I'm like, chill. Like, I'm joking with my friends. Like, I swear I'm not pushing this sport on him at all. No. I literally have not encouraged this. Like, and
nor did we. We didn't push it at all.
And I talked to that same person, my friend, he played D1 football at Boston College. tore his Achilles, had injuries. And he's like, I don't want my son to play. He's saying that. He's like, keep him in soccer. And so we had that whole conversation. So this is very timely. So keep me reported on your 16-year-old.
I'll keep you updated.
Keep me reported on that. And I'll keep, he's starting flag football. That's all we got right now. So we will stay engaged. Well, this has been a great episode. This has been a blessing to have you on here. As I normally do, this is part of the show called Shout Outs and Plugs. So shout out means you can show love to anyone you want to show love to. And then plugs, these are things that you would want the listeners just to be aware of, whether the resources here at Mason that you want me to put. I put these plugs, links in the show notes. So the stage is set, shout outs and plugs.
Excellent shout out. So I really want to shout out to all the members of our college. They are showing up, our faculty, our staff, our students. They're showing up in major ways. They really care about this place, and that's what makes it such a great place to work and to be a part of, and makes me so optimistic about the future. And then the plug is, if you all could follow us on our LinkedIn page, our college, George Mason College of Public Health, it would mean the world to us. We're posting as much as we can, all relevant to many of the topics we've been talking about, relevant to public health activities, relevant to nursing, to social work, to the things that our students are doing. They're doing incredible stuff. I know you would love it. So I'd love for your listeners to connect with us on LinkedIn, George Mason College of Public Health.
Yeah, I definitely put that on shows. I do follow it too. Shout out to Kevin. He got me sucked into the public health world. Also, I'm going to do a little shout out too. You have 2 outstanding faculty members. I don't know. I'm assuming they're good faculty, but they're great people. Jenna Kroll and Anna Pollack.
Amazing people.
I know them
Amazing
personally,
people.
and so I was like, this is cool, man. If they wanted to snatch me up, maybe I would have got a doctorate here. But, it's neither here nor there. But great program,
You'll always
great people.
be part of us, Philip. You're always got a place here that we'll always welcome.
I don't know. I still have to define my concentration. I might be health communications. You never know. You know what I'm saying? So mental health, well-being, that intersects. But well, thank you so much. I really appreciate your time. And if Positive Filter listeners, if you have any questions for the podcast, please follow us on all our platforms. If you could give us a like or subscribe or review, it's really greatly appreciated. Share this episode with family and friends. As I said, on every single episode, every episode is dedicated to the memory of my father-in-law, Jeff Kirsch. So in the show notes is also the Jeff Kirsch Anti-Hunger Fund to celebrate the life and legacy of Jeff Kirsch. So please consider donating to that, and we're out. Thank you for listening to Positive Filter, a podcast that focuses on family, friends, career, with a little self-help along the way. If you enjoyed this podcast, please share it with your family and friends, and like the Facebook page, Spreading Positivity of Movement. Thanks for listening.